Good day, everyone. I'm Theviga Apparao, first year medical student. My metric number is BM23110023. I researched about the female reproductive system. Today, I'm going to present about the vital organ in the female reproductive system, which is the uterus. First, let's explore the anatomy of the uterus. The uterus is a thick-walled, pear-shaped, hollow-muscular organ. The non-gravid uterus is approximately 7.5 cm long, 5 cm wide, and 2 cm thick, and weighs approximately 90 grams. The non-gravid uterus lies in the lesser pelvis, with its body lying on the urinary bladder and its cervix between the urinary bladder and the rectum. The adult uterus is usually anteverted and anteflexed, so that its mass lies over the bladder. The position of the uterus changes with the degree of fullness of the bladder and the rectum and the stage of pregnancy. The uterus can be divided into two parts, which are the body and the cervix. The body of the uterus, forming the superior two-thirds of the organ, includes the fundus of the uterus. The cervix of the uterus is the cylindrical, relatively narrow inferior third of the uterus. It is approximately 0.5 cm long in an adult non-pregnant woman. Uterus has several types of ligaments. Broad ligament acts as a mesentery for the uterus and contributes to maintain it in position. Round ligament function to maintain the anteverted position of the uterus. The ovarian ligament joins the ovaries to the uterus. Cardinal ligament contains the uterine artery and vein to provide support to the uterus. The uterosacral ligament provides support to the uterus. Apart from that, blood supply of the uterus derived from the uterine arteries with collateral supply from the ovarian arteries. Uterine veins form uterine venous plexus on each side of the cervix. Parasympathetic fibers of the uterus are derived from the pelvic splenic nerves. Sympathetic nerve fibers of the uterus arise from the uterovaginal plexus. Moving on to the histology of uterus. Body of uterus contains three layers, which are endometrium, perimetrium, and myometrium. Perimetrium lined with simple squamous epithelium and composed of perioral connective tissues. Laterally, it becomes the broad ligament, and anteriorly, it covers the urinary bladder and forms a shallow pouch, which is known as the vesicouterine pouch. Myometrium contains three layers, which are subvascular layer, vascular layer, and supravascular layer. The subvascular layer mainly participates in the sealing of the tubes and the separation the endometrium during the menstrual cycle. The vascular layer plays a major role during labor. The supravascular layer is a thin sheet of crossing muscle fibers that stabilizes the uterine wall. Endometrium is highly vascularized. Endometrium is divided into two layers, which are stratum functionalis and stratum basilis. The stratum functionalis lines the uterine cavity and sloughs off during the menstruation. The stratum basilis is permanent and gives rise to a new stratum functionalis after every menstruation. Next, I would like to talk about the most important biochemical reaction in the uterus, which is the menstrual cycle. Menstrual cycle involves a lot of hormones such as follicle-stimulating hormones, FSH, luteinizing hormone, LH, progesterone, estrogen, and gonadotropin-releasing hormone. There are four phases in the menstrual cycle, which are menstrual phase, proliferative phase, ovulation phase, and luteal phase. In the menstrual phase, menstrual flow from the uterus consists of blood, tissue fluid, mucus, and epithelial cells, which set from the endometrium. Declining level of progesterone and estrogen stimulate release of prostaglandin that cause the uterine spiral arterioles to constrict. The entire stratum functionally slopes off. The endometrium is very thin, about 2 to 5 millimeters. In the proliferative phase, estrogen is secreted by the growing ovarian follicles to stimulate the repair of the endometrium. Cells of the stratum basilis undergo mitosis and produce new stratum functionalis. Endometrium thickens and endometrial glands develop. Arterioles coil and lengthen in this phase. The next phase is ovulation. Rupture of mature follicle and the release of the secondary oocytes into the pelvic cavity occur. High concentration of estrogen stimulate the release of gonadotropin-releasing hormone from the hypothalamus. It also stimulates gonadotrophs in the anterior pituitary to secrete luteinizing hormone. Gonadotropin-releasing hormone promote the release of follicle-stimulating hormones and additional luteinizing hormone by the anterior pituitary. Luteinizing hormone causes the rupture of mature follicle and expulsion of secondary oocytes after the peak of the luteinizing hormone surge. In the luteal phase, progesterone and estrogen produced by corpus luteum promote growth and coiling of the endometrial glands. Vascularization of the superficial endometrium occur and the thickening of endometrium to 12 to 18 millimeters in this phase. If fertilization does not occur, the level of progesterone and estrogen decline due to degeneration of corpus luteum. Decline in progesterone and estrogen level cause menstruation in this phase. Next, let's take a look at the disease which is related with uterus. The most common disease related with uterus is the uterine cancer. Cancer of uterus occur when abnormal cells develop in the uterus and begin growing out of control. There are two main types of cancer, which are the endometrial cancer and uterine sarcomas. Endometrial cancer begin in the lining of uterus, while uterine sarcomas develop in the myometrium. There are 4 stages of uterine cancer. In the first stage, the cancer is within the uterus. In the second stage, the cancer spread to the cervix or the stroma. In the third stage, the tumor has spread past the uterus and cervix, but not past the pelvis. Tumor spread to vagina, ovaries, and fallopian tubes. In the fourth stage, the cancer has spread past the pelvis and is within the other organs such as intestines. Among the causes of the uterine cancers are taking tamoxifen to treat breast cancer, being postmenopausal, starting early periods which is before the age of 12. There are several symptoms of uterine cancers. They are abnormal pap test results and pelvic pain, painful urination, and also pain during intercourse. Usually, uterine cancer can be treated by surgery and chemotherapy. The famous gynecologist that I discovered is Dr. James Marion Sims. Dr. James Marion Sims was an American physician in the field of surgery, and he is known as the father of gynecology. Dr. Sims developed a precursor to the modern speculum using pewter spoon and strategically placed mirror to check the vagina. He performed experimental surgery on women to treat vaginal problems and researched more about the gynecological diseases. He developed techniques that have formed the basis of the modern vaginal surgery. He developed a surgical technique for the repair of the vesico-vaginal fistula. Dr. Sims invented the Sims position, which is a position used for the rectal examination, treatments, and the examining of women for vaginal wall prolapse. Thank you.